During the crisis in the Ivory Coast last March, Douekwe's hospital found itself on the front line. The team, which kept the hospital going as well as it could, was witness to the violence.
There was a lady who was killed, right there, shot by a stray bullet. She died here in the delivery room. They just came in.
Calm has now returned to the region, but the hospital is overwhelmed. MSF teams handle surgical emergencies, which include the many road accident victims, and provide obstetric, paediatric and general medical care.
As MSF is working in Douekwe's hospital, healthcare is free, and there are medicines, medical supplies, and staff. So we have patients who come from a long way away.
The provision of free healthcare decreed by the government has not really been enforced, and medicines are in short supply or need to be paid for. In spite of the return to peace, the people are still very vulnerable. This is the Women's Hospital in Peshawar in northwest Pakistan. Run exclusively by MSF, the facility was opened last May to make up for the lack of specialised medical staff. The 30-bed hospital provides emergency gynecological and obstetric care.
All these patients suffer from some kind of deprivation. They may quite simply be poor. They may be displaced, but they may be refugees. And they probably wouldn't have access to this kind of high-quality treatment without the MSF hospital.
Surgery, obstetrics, medical consultations, hospital admissions, etc. Treatment is provided free of charge here, and the hospital is open 24/7. The medical staff are all females. This is an issue when we want to recruit, and it could hold the project back. There are regular skirmishes on the border between Katanga and South Kivu province. Last December, the MSF team in Kalemi set up operations to meet the needs of the people displaced by the fighting. Thousands of people in the camps were in need of medical care and drinking water.
Initially, the program's objective was to provide an emergency medical response for this particularly vulnerable population, who were arriving in large numbers. It was the beginning of the rainy season, and there was an increase in the number of cases of malaria, plus a lack of food, leading to malnutrition in children, and also diseases with epidemic potential, such as measles and cholera. These were diseases we had to look out for.
At the end of August, after 6 months working in the west of Kalemi, MSF focused its activities on 2 new camps to assist the newly arrived displaced people. MSF now works in 2 health centres in Tabakongo and Mutua, where teams carried out a vaccination campaign. It has also set up a hospital with some 20 beds. Arise is 26 years old and has just had a motorbike accident. The surgical team in Teme Hospital is performing internal fixation to repair her fractured bone. Traffic in Port Harcourt is lawless and there are countless road accidents. Their victims make up for 1/3 of the patients in the trauma centre run by MSF. Injuries related to violence are the other main cause for surgical intervention.
40% of our patients, at least 40, maybe 45, are linked to gunshot wounds, to machete cuts, to any type of trauma linked to violent behavior.
The team, which includes both Nigerian and international surgeons, performs high-quality surgery in conditions approaching Western standards. Violence remains rife here, in spite of the stabilization in the region's political and security situation. The people here in the Bekele district have very little access to healthcare. They are very isolated, mainly because of the long distances. MSF opened a program in May 2011 and works at the hospital in Bekele and in 3 health centres on the outskirts of the district. MSF teams frequently see patients who have first used traditional medicine and who then come to the hospital very late on for treatment. They are often serious cases.
This patient is a good example of what happens in Madagascar. She saw somebody who wasn't medical, who had no professional medical training, and who treated her, and who gave her intramuscular injections for a couple of weeks. And then she got an abscess because the injections weren't clean.
The woman will have to spend nearly 2 weeks in hospital. The teams handle emergencies and run the medical, obstetric and paediatric units. Dr. Naina Bala is off to give consultations in one of the health centres. Women attend for antenatal visits or for their children. To be closer to their patients and raise awareness of the importance of getting treatment quickly, the teams also hold mobile clinics in the villages.